Can toddlers with autism lose their diagnosis? This is such an important question, and some recent research indicates that almost 40% of toddlers diagnosed with autism could indeed lose their diagnosis. This is a controversial topic and a controversial podcast, but it's an important one where I'm going to be reviewing the most recent research published in October of 2023. Let's get to this question and some answers. Hi, welcome back. If you're brand new here, a special welcome to you. And if you've been listening for years, I really thank you for helping me spread the word, spread information that might be helpful to other parents and professionals, whether they have a child or client with autism or a toddler just showing signs, which is my passion to get to kids as early as possible so that we can, quote unquote, turn things around. So today I am covering a review of this recent research paper called Persistence of Autism Spectrum Disorder from Early Childhood Through School Age. And it was published in JAMA Pediatrics by Dr. Elizabeth Hartstad et al. There's a bunch of authors on the paper. They are all from Boston's Children's Hospital and up that way. So the way I even found this article is on TikTok, which, if those of you that don't know, I am everywhere. TikTok, YouTube, Facebook, Instagram, LinkedIn. You can always find me at any of these social media platforms, marybarbera.com/TikTok, LinkedIn, YouTube. You can find me everywhere. And if you do find me, make sure you subscribe and like and comment and tell the algorithm that you would want to see more of my content. And I put out so much free content, and I'm grateful that you're listening and that you're sharing with others. That's really my goal, to get it out there. So the way I found this out was on TikTok with a creator who goes by Speechy or Miss Michael. And she's a pediatric speech and language pathologist. And she was talking about this ASHA article, which was published at the end of October 2023, entitled "Some Toddlers with Autism May Lose the Diagnosis as Children." And this was basically a little review of the main article that I was able to download. And we're going to have links for these in the show notes below this video on my website. So let's get to what the data show and why is it important. So past studies have been done on whether children, how much they get better. Do some get all better? Do some stop showing signs of autism, or what happens? And in the past, this has been termed autism recovery, becoming indistinguishable. And in both of my books, I talk about old research, which shows anywhere, even in my recent book, Turn Autism Around, I think studies vary from 4% could become indistinguishable or, quote unquote, recover from autism, 4% to 47%, somewhere in that realm, or if you take all the research over the past few decades. But there hasn't really been good research that I'm aware of, especially since PDD-NOS is no longer a diagnosis. So a lot of those longitudinal studies were older and included kids with PDD-NOS, which was not fully meeting all the diagnostic criteria. And then the other problem with research is we had COVID kind of in the middle of it. So this is a brand new study that has a lot of pluses to it because the real research was done during and post COVID, but all the kids had a diagnosis of autism spectrum disorder, not PDD-NOS or Asperger's syndrome. So I found out about it through Miss Michael. She actually had some problems with some of the wording on the ASHA paper, which was an analysis of this original research. She was concerned that, they said in the ASHA paper, which was very short, that some children outgrow autism. Some people outgrow their diagnosis. Some children no longer have autism at 6. But throughout the paper and even in prior research, early diagnosis isn't always stable, especially in the past with PDD-NOS. So, as I said, in both of my books, some of my blogs and podcasts, I do talk about kids that I know personally who got all better or mostly better, who, are driving, going to college. Do they still have some issues? Some of them do still, identify with the diagnosis of autism, or some of them have, anxiety, depression, learning disabilities. So this study did not look at like other diagnoses. They simply took 213 children who had been previously diagnosed prior to COVID with autism spectrum disorder, met the criteria of the DSM-5. Out of the 213 children, 177 or 83% were boys and 36 or 16.9% were girls. These 213 children were diagnosed between 12 months and 36 months of age, with the mean being 24.6 months. So while there were a few kids diagnosed between 12 and 18 months, the majority of the kids were diagnosed between 18 months and 36 months, and the mean was 24.6 months. So the study was simply to determine what percentage of these children continued to meet the diagnostic criteria at age 5 to 7 years of age. So follow-up assessments were done 2018 to 2022, and they did say in the study that half of the assessments, the practitioners and maybe the kids needed to wear face masks. I did do a previous show with Catherine Lord in the height of COVID, and she is a world-renowned autism researcher. And we talk in that episode, which we can link in the show notes, about the issues with the diagnosis during COVID with the use of face masks and other protective gear. So on the all the children, the 213 children, the ADOS was done. The Bailey 3 for infants and toddlers and the Vineland was done at the diagnosis time at 12 to 36 months of age. And then when the children were between 5 and 7 years of age, I think it was 5 years after diagnosis or approximately. Again, the ADOS was done, but it was the ADOS-2. The ADI, which is an interview, was done. The Bailey 3 was done, and the Vineland. Some of the children that had higher language abilities were also given the preschool language scales. So at follow-up, 79 out of the 213 children, or 37.1%, no longer met the diagnostic criteria for ASD. So in the article, they called this non-persistent ASD. So all of the 79 children had IQs above 70. And then those where ASD persisted, 46 of them had IQs below 70, and an intellectual disability. And then 88 of the persistent ASD had IQs above 70, or 88 children. So all of the children, all 213 children, had some kind of intervention, with 94.4% of them receiving ASD specific intervention, mostly ABA treatment, applied behavior analysis. And then some of them also received general interventions, not specific to ASD, like occupational therapy, speech therapy, etc. So interestingly, the only two variables that made a difference in best outcome versus persistent ASD was females did better. Out of the 36 girls in the study, 22 had non-persistent ASD and only 14 had persistent ASD. So that was kind of striking. And then the other one was higher baseline adaptive skills. So, you know, I've done a lot of work over the years with stressing that we're not just talking about language. We're not just talking about expressive language. We're talking about self-care skills, adaptive skills like hand washing. So if you have a 2.5-year-old who's potty trained, that would be a high baseline adaptive skill. That would be actually on the earlier side. But if you go in for a diagnosis at 4 and your child's not potty trained, won't wash their hands or can't wash their hands without assistance, can't dress themselves, those are poor adaptive skills. So the only two variables, again, were the female sex and higher baseline adaptive skills. Prior studies with best outcomes were small, and then they had that diagnosis of PDD-NOS mixed in. But some of the variables that showed in previous studies to have best outcome were diagnosing at a young age. Although it was interesting because I said there were only 5 children diagnosed in this study between 12 months and 18 months. And I believe 4 of them had persistent ASD and 1 of them did not. So diagnosis at a young age, higher cognitive level at baseline. These are previous studies showed this. Higher language and adaptive skills at baseline. And one large study from California in the past showed well-educated moms had better, their children had better developmental trajectories. This study did analyze the income levels and the socioeconomic status of the families. And I believe like 67% had college-educated moms and more white people, less Hispanic. It was in Boston. I'm not sure what the exact stats are from the socioeconomic class, but in general, people that completed this study had early diagnosis. They had well-educated moms, and they had a higher socioeconomic status, and they were more white than average. So those were all intertwined with the studies, but again, only those 2 variables showed significance. Now, so why is this controversial? I said in the beginning this was controversial, and it is. You know, we've been talking about this for years, and I think with the autistic adults and people that believe strongly that autism is a gift, and that we shouldn't try to change anybody, and we should, even Miss Michael from TikTok believed that these children could be masking or being taught how to behave, perform socially. So, in fairness, I mean, she raises a lot of good points, because like, what will these children be like not just at 5 or 6 years of age, but what will they be like at 12 or 18? Will they have issues? Will they have social issues? Will they have bullying? Will they have depression and anxiety? And I mean, the rate of all of that, even without autism in the past, is very high among children and teens. So I don't think it needs to be controversial. In my book, Turn Autism Around, in my courses, and in podcast 93, I really dive in deep to the work of Dr. Ame Klin and his colleagues who, I asked a question, and I talk about this in podcast 93, but, I asked him, do you think autism can be prevented? And he said, you can't prevent the autism, like the genetic gene part of autism, but he believes you can teach, prevent, teach, and sometimes reverse severe language delays, adaptive deficits, problem behaviors, to reverse those. And these things often accompany autism and can really change the trajectory of things. If you have a child who has a significant language disorder on top of autism, and they have severe problem behaviors, you really need to tackle those things that can be changed to change the trajectory. So I don't think, even if it's 4% of kids, and this study is showing 37%, it's over a third of the kids with an actual diagnosis of autism could no longer meet the diagnosis between 5 and 7. They did not show a high any correlation between kids that got more intensive services doing better. They did say in the study that kids that got more intensive services initially and then they were faded out from services, that was pretty much what kids did. And this is just one research study with 213 kids. So this isn't the be-all, end-all. Of course, we need more data. We need more data from this cohort of children. We need more data about the interventions, about what the parents did, which we just don't have. But I do think that we need to do a whole lot more research on these adaptive skills. Like within my assessment, my digital assessment, that is still free. Over 30,000 people have taken the 10-minute assessment. It's a third of self-care, adaptive skills, daily living skills, eating, sleeping, potty, dressing, grooming. Those are all adaptive kind of skills in there. We have a third of the assessment results in language and learning skills, not just expressive language, but how much they're understanding, their cognitive abilities, their ability to imitate. Those are all really important skills as well. And then a third of my digital assessment is on problem behaviors. And, I just want to help people get their kids, whether it's their children with autism, signs of autism, or clients, to reach their best outcome, whatever that is. So I think this study, Persistence of Autism Spectrum Disorder from Early Childhood Through School Age, is a great study that at least provides some evidence, recent evidence, that kids can do really well. Many of the children, most of the children did receive some type of ABA. Everything I teach is based on ABA, but it's parent-friendly, child-friendly. It's not enroll them in anything where you can't be a strong component of the program so that you can learn as a parent how to become the captain of the ship. And that's really my mission, and really the way I think kids are going to do best. especially kids between 12 months and 36 months. So I was excited to find this study. Thank you to Ms. Michael for sharing it on TikTok. And I think we just need to do a really great job of doing more research like this to show what's possible and really help others who are just at the beginning of their journey. So hope you got a lot out of that article review and the research and talking about, young kids. And if you have an older child, my son is in his late 20s at this point. He is not a best outcome kid, even though I've done everything in my power, but he is as safe as possible, as independent as possible, and as happy as possible. And, these kind of studies are great moving forward. They're great for potential great nieces and nephews. They're great for great grandchildren and for people that want to help their neighbors and relatives and friends, spread the word and help me get the word out that whether they get an early diagnosis or early treatment, things can get better and often do get better, and often get a lot better, and even to the point where some toddlers may lose their diagnosis. So hope to see you next time, same place, and talk to you then.